recommend someone just start out with like the prototherapy first off then?
It all depends. Some patients we do recommend to start out with prolotherapy. Other patients we recommend that they actually start with a stem cell treatment. It all depends on several different factors. That's going to include the severity of the injury, where the actual injury is, the overall health of the patient and the health of the tissues in the area. Those are probably our biggest thing. We're not a cookie cutter place. These are not protocols and algorithms. All of this is individualized to the person in front of us. And so at the end of the day, these are all considered regenerative injections, meaning that while they work a little bit differently, prolotherapy, PRP, and stem cell therapy all are trying to accomplish the same thing. The analogy that I usually use is these are like alcoholic drinks. So the prolotherapy is like a Bud Light or like a Michelob Ultra. The PRP is maybe like a glass of wine. And then our stem cell therapy is like a shot of vodka or whiskey or something like that. All of those at some point will get you intoxicated. You'll get drunk off drinking Michelob Ultra. You just have to probably drink a lot of them. And sometimes if you have somebody who's very, very small and they don't drink alcohol a lot, they don't need to take a shot in order to get drunk. They could probably just have one beer and they will feel the effects and be intoxicated. And so that's kind of the way that I think about these regenerative injections. All of them are trying to accomplish the same goal. Yes, they do it a little bit differently, and there's strengths and weaknesses of each of them based on what tissue we're injecting and the severity of the injury that we're working with. But they're all usually indicated, and then it just becomes a question on the strength. So do we want to start with something lighter to see how you respond before we move into something that a bigger financial investment? Or do you have a situation where we really need to start with something stronger like PRP or stem cell therapy because of different factors of the things that we have already discussed?